it's a myth that, laser will give you side effects or damage your skin, but it's always necessary to maintain your skin.
I've never heard this anywhere. Anywhere, even if like the biggest doctors also, they just wrap it up.
That PRP, if you have heard of vampire facial.
Yeah. I'm curious about that, by the way.
I was researching since many years about the latest technology, what is suitable for Indian skin type and everything. My main vision is, if you're stepping into my clinic, if you're spending a bomb on the skin treatment, then you should have that positive vibes.
Hey everyone, this is Shruti. Welcome to my podcast, I'm Just Curious, where I talk of all things I'm curious about with the people I'm curious about and how they turn their passion into their profession. In today's episode, I'm going to be talking to someone who turned her lifelong passion for skin, health, and dermatology into her profession. She's a mother of one and she's thriving as a dermatologist, as one of the sought-after dermatologists in Ahmedabad. So I'm very happy and excited to have Shailee Banker with me on the podcast today. Hi Shailee.
Hi, hey Shruti. Glad to be here and thank you for inviting me.
Sure, it's my pleasure and very happy to have you here. Let's start from the beginning. What sparked your curiosity about skin, about dermatology? Like, is there something since childhood that you were, drawn towards?
So I can say since childhood, I had a fascination and interest in skincare and beauty. And so being a dermatologist now, I have the opportunity to make an impact on people's life by giving them a healthy and glowing skin.
Yeah.
And so with the medical knowledge that I have and the aesthetic expertise that now I'm thriving, I'm sure I can give them the best skin ever.
Yeah. But is there, like, when you look at your childhood or something, since children we are drawn towards certain things, was there any particular incident that comes to your mind? Any particular, what is the earliest memory that you have that, draws you towards this profession?
Right. So as far as I remember, like most other girls, I used to play with my mom's makeup kit. And I remember one incident where my grandmom, she always used to apply some facial creams on her face.
Right.
And one fine day, I just grabbed her cream, put it on my face, and I was very excited to see the result.
Oh, wow.
And that is how, I was very much into cosmetics.
Yeah.
But lately I realized the transformative power of cosmetics. And now being a dermatologist, I know how effective it is. But the basic thing is to have that healthy, glowing skin as a foundation so that all the cosmetics can go on your skin.
Right. That's a very good point that you mentioned. Like, it's all about the health, be it skin health or, like other kinds of health. Talk to me about, like, once you figured out that, okay, this is what you want to do, what is the next thing? What are the next steps that you took that you were like, okay, I need to finally turn this into my profession from a passion?
Right.
How did you do that?
So basically, since I took a 4-year experience of dermatology, I was looking at the people around. I was always very admired by people for my dressing up, for my skin and everything. So I thought, why not I inspire people, I motivate them, make them understand how their skin type is, and make them understand how important skin care is.
Yeah.
So nowadays, most of the people, they are aware of the importance of the self-care.
Yeah.
And skin care being an essential part of it, it's very easy to convince them.
Yeah.
So I studied for 3 years and I deeply understood how your skin is. And then I hope I can make everyone understand that. And that is how I'm into this.
Great. So you have like a lovely clinic in Ahmedabad.
Right.
Talk to me about that. How was that process of, when you finally started your own clinic? It's a one thing to dream about it and then you finally get to do it. That's a different feeling altogether. So talk to me the process of, going about that, like finally starting your own clinic and, taking that one step further.
So since my field is all about aesthetics, I always wanted a good ambience, a good positive vibes. I was working as a consultant at some other chain of clinics for quite few years. And I was researching since many years about the latest technology, what is suitable for Indian skin type and everything. And so my main vision is, if you're stepping into my clinic, if you're spending a bomb on the skin treatment, then you should have that positive vibes. So this is my second baby, my clinic. And that is how, with the support of my husband and my family, I have this dream come true.
Lovely, lovely. That's lovely. It's a very good thing that you mentioned that, like about the vibes that you mentioned, like, wanting to create the Zen vibes and everything. I really love that thought behind the clinic because I feel like it shows that it's not just about outer skin health or skin appearance, but it comes from within. So if you feel good in a space, if you like, you have good vibes, positive vibes around you, it will show on your face and it will take that treatment or something one step further. I feel like that's what your concept was. Lovely, lovely. Take me through the process of, like, say, for example, somebody who's watching and if they want to, come to your clinic for a consultation, take me through the process. What are the steps? What are the procedures that you follow?
So basically, it's a very systematic process that we have. So once you step in my clinic, we click your pictures. So I make sure that before he or she comes into my consulting room, I look at the pictures, the plan is going in my mind. Because it's all about that customized treatment plan for everyone.
Sorry to interrupt you, but I can agree with that because when you saw me, you got into your dermatology mode immediately.
Yeah.
You're like, okay, how
I just need a picture and that you don't even need a man mein laddu photo.
You don't even need like a physical camera to click a picture.
Yeah.
Your eyes click a picture and your brain starts working.
Start working on that. So it's all about a customized treatment plan for everyone because everyone's skin is very different. Yours is oily, mine is dry. Most of the people, they have combination skin. If some treatment is working on you, that might not work on me. So it's all about knowing your concerns, your goals, your expectations. Then I make a plan on a paper. I make them understand. I prioritize that there is a clear communication between a patient and a doctor. I make them understand how it works, that it is going to be a gradual process. And so then we consult, I listen to them very patiently. It takes me 30 minutes to 40 minutes for a consultation. And
Nice.
that is how we prioritize on a customized plan for it.
Lovely, lovely. And I think the point to note here is that you mentioned that you spend 30 to 40 minutes talking to the patient and consulting them, which is, I've never heard this anywhere. Anywhere, even if like the biggest doctors also, they just wrap it up here, like they don't, I've never heard this.
But I'm fond of talking. So other than skin, I do talk with them about their personal life. Because see, everyone has a busy schedule. The life is very hectic and stress, hormonal changes, everything affects your skin a lot. So I go in deeper details and I make sure, they are psychologically very calm and everything once we start with the treatment. So
I think that's very lovely, and everyone watching also, should note, and people who will want to consult you in the future, that it's not just about the superficial that, oh, I'm getting paid and I will just, give them a treatment, and because they're going to pay you anyway if they're going to consult you.
Yeah.
But, you're taking that so much effort to know them personally, to invest so much into their lives and, make them feel part of your like a journey and like a part of your clinic, like not just like a separate entity, which is what somebody would feel. And I think that's the lovely way to go about it. Talk to me about, like, what are some of the most common issues and the most common treatments that you recommend people?
So lately, the most common skin issues that I deal with are acne scars, various types of pigmentations. Mainly post delivery, people have a lot of hormonal pigmentation that is very difficult to treat, very challenging.
Why do you think that happens?
So basically, that is mainly internal. There are a lot of stress and hormonal changes that everyone is going through. So that reflects on your skin.
Right.
Post-COVID, I have seen a lot of cases of hair fall.
Okay.
So that is one trending thing that I can say. And so those are the most common disorders. Other than that, I also treat psoriasis, eczema. So those are the dermatological disorders that is a very chronic thing.
Chronic issues, yeah.
Chronic issues. So it doesn't, we can't solve it in less than a year or something.
Yeah. And it's like an ongoing process. You have to keep at it. It's not something that's just going to go away with like a one sitting or something. Talk to me about like what are some of the biggest myths that people have when it comes to skincare and when it comes to hair care. Like you said, people come to you more for hair loss these days.
Right.
What are some of the things that you've observed that are very, very common?
So the most common issue that I'm facing today, these days, is people think that hair fall is under control of shampoos and using a lot of oils and everything, but shampoo will never affect your hair growth or hair fall. So that's a myth that using different shampoos, changing your shampoos frequently will give you more volume or more anti-freeze hair, but that's a myth. Again, talking about skin, the most common myth that I've seen is people don't apply sunscreen indoors. So,
Guilty. I do that. And I think about it. I'm like, I'm not
especially for guys, when I tell them to apply sunscreen indoors, they are like, but I'm always in the office.
Talk about applying sunscreen outdoors. What? Forget about indoors.
Exactly. So that is what they say. But they forget that other than sun rays, it is the lights that
I get it. Yes. The UV rays, the light from your laptop screens and everything.
your mobile screen. So that damages your skin way much than the sun rays.
Yeah.
So that's a myth again. People feel that oily skin get more acne, but
That's not true.
that's not true again.
Okay.
So that's a
Interesting.
myth. Yeah. So people start washing their face very frequently, which wipes off all the necessary oils from your skin, which leads to more oil production on the contrary. So that's a myth again. It should be balanced, not very oily, not very dry. So yeah, those are the
Few myths that you said. Right. Talk to me about, like, say for example, if we talk about right now, the season is very unpredictable. Sometimes it's hot, sometimes it's humid, sometimes it's raining. How would you suggest, our viewers watching to take care of their skin in such an unpredictable weather? Like, like some of the basic things that could work for everyone. What would you say to them?
So I would recommend that we can't keep switching our skincare products now and then according to the weather. But you can just follow the basic rules for skincare. That is just a good sunscreen every single day, a good moisturizer according to your skin type, and a lot of hydration. So for me, hydration is a key for the ultimate glow. And so I would recommend it to every single person.
Right.
Yeah.
Okay, great. That sounds good. Talk to me about what is one of the advice that you would like to give someone watching who wants to follow this career path but is confused how to go about it, what to do, because nowadays everything is very daunting and very intimidating because you feel like everyone's doing everything and you have to be the best and everything. So what would you tell them?
I would say every day 2 to 3 patients, they come to me, they ask me, doctor, I'm very confused looking at all the products that is there on the Instagram and everything. But please go to your dermatologist, get your skin analysis done. Let he or she guide you how to take care of your skin further. And it's a myth that, laser will give you side effects or damage your skin, but it's always necessary to maintain your skin.
Right.
So I would suggest once you are 20, you should start working on your skin because your collagen, your elastin, it reduces 1% each year.
Okay.
So that is how you can just start with a basic skincare routine and then you can follow the remaining treatment.
Okay, I'll ask you some of the products and you can say yay or nay, because like these are more trending products and everyone is advising. All the skincare influencers are like, this is my skincare routine. And so, okay, so let's start. Are you ready?
Yeah, I'm ready.
Salicylic acid.
Yeah.
Okay. Retinol.
Yeah.
Okay. So far, I feel like I'm losing. Vitamin C serum.
100%. Yeah.
Okay. Hyaluronic acid.
Nay.
Nay. Why?
So not everyone needs hyaluronic acid, but yes, after skin analysis, if your skin gives you that sign that you need hyaluronic acid, then you do have to apply.
Okay. Now, can you tell me, like, since you said yay for most of them, can you give me an order in which these products should be applied for, like, good result?
Right. So basically, the main thing is everyone doesn't need everything, right? Even these products are very customized according to your concern, according to your skin type.
Right.
Also, we follow a pulse therapy, or you have to use one product one day, second product other day.
Okay.
You can't use everything together.
Okay.
So I generally, according to your skin type, if you need salicylic acid to be applied once or twice a week, retinol once or twice a week, so we customize accordingly.
Right.
So, but yes, retinol, salicylic acid, and vitamin C, those are the three necessary ingredients to maintain your skin.
But in what order you should apply?
The order, the first thing should be after washing your face, it should be a moisturizer with vitamin C.
Right.
Retinol and salicylic acid is to be applied at night. So,
Okay.
every night when you wash your face with a good cleanser, you can just apply a good moisturizer, mixing a salicylic acid serum or retinol in it, and you're done.
Okay. Nice. Interesting. Talk to me about like any challenging cases that you worked on that you felt like, okay, this really challenged me, which was like out of the blue, and talk to me about that.
Okay, so Shruti, basically every cosmetic case is a challenge for me
okay.
because of unrealistic expectations that people have. They either want to get treated overnight or in less than a month, which is not possible. But yes, the most challenging case that I have is the hormonal pigmentation that I had mentioned earlier.
Right.
Because we don't really know the cause, right?
Right.
We call it hormonal, but there are a lot of internal
What is
things.
affecting it? You guys still don't know.
Exactly.
What are the
So,
factors
so
affecting
that is
it?
still under research. They are researching on your body, metabolism, a lot of other things that is going on in your body, which is affecting your skin.
Right.
So that is very tricky for me. Initially, there were not very good treatments to solve that hormonal pigmentation. But fortunately, we have a very good quality lasers now. So we can treat the hormonal pigmentation called melasma very well. And the tricky part is maintaining that. So even I've treated a lot of melasma cases. Patients are good, but then after a few months, they come with some pigmentation again. So that is very challenging, convincing them to maintain whatever results they have got. So
To keep faith.
to keep
Basically
faith, yeah.
in the treatment that that this is like a normal part of this.
Exactly.
And you have to keep faith and you have to keep doing it.
Yeah.
To
So
receive
that's,
long-term
melasma,
results.
I can say, is very challenging for us. Yeah.
Yeah. Talk to me about what are some of the most exciting developments in the dermatology industry that you're very excited about.
Yeah, so I'm very excited about the non-invasive treatments that is coming up. We are focusing more on non-invasive body fat reduction.
Oh, nice.
Non-invasive injectables called Botox fillers, and a lot of hydration injections. That
Can you talk to me? Can you elaborate a little on the process or something?
So initially, a lot of plastic surgeons, they used to do invasive liposuction that you might have heard of. So that's a surgical thing where we remove all the body fat, putting incisions and everything.
Yeah.
But now we are coming up with a new technology. So there is no surgery, there is no scar, nothing.
Interesting.
It's a laser which will put some, there are rays, and that will just cause the fat reduction. And so that's a new technology that we are coming up. Again, there are a lot of injections. So nowadays, I'm seeing a lot of cases where your skin is very sensitive, right? Every second person has a sensitive skin. Lack of hydration, that causes a lot of dryness. So we have various skin boosters. So this skin boosters, that is basically hyaluronic acid.
Okay.
So rather than applying it, we inject it in the deeper layer of the skin, because that gives you a long-term result. And that is when, topical things doesn't work. So that is the thing that what we can do.
You can guarantee at least this way it will work because it's been like given to the deeper layers of the skin and everything.
So even lasers, we have a lot of non-invasive lasers now. If you have deep acne scars, we can just treat it with a laser which doesn't give you any downtime. So that PRP, if you have heard of, vampire facial.
Yeah. I'm curious about that, by the way.
Yeah, so that's the safest procedure because it's your blood that we use.
The platelet-rich
plasma.
Yeah.
So we take your blood, we process it, and then we inject into your skin. So that does the magic. So that's again very upcoming. We do it a lot. So nice. I'm very excited about this body contouring device. I mean,
Okay. But what would you tell someone, because lasers, for Indian people, like lasers is like, oh, scary, like radiation and everything. What would you tell people who are scared of, like say skin cancers or, issues like that when it comes to lasers? How would you make them feel comfortable that this is safe?
so basically we have different lasers for every concern, right? So all these lasers are wavelength based. Wavelength is how deep the rays go. So it is very safe because it's not going to penetrate beyond your skin.
Right.
Again, laser is just a light beam. It's not an ionizing radiation like the sun rays are, right? Sun rays, they are ionizing radiation which affects your DNA, causes ionization and everything. But laser, on the other hand, it's just a light beam that is going in, absorbed by the targets, and the process is done. So it's very safe, and there is no long-term side effect.
Yeah. That's very nice. I hope that's very calming and that's very comforting for people who don't know that. Because people think that so many people, even my mom, when I tell her, even when we talk, she's like, oh, but what will I get? And I'm like, it's different. No free radicals are being produced in your body. That will cause
Sun exposure is more damaging than
yeah, exactly. Yes. How do you stay up to the mark in your field? When there's been so much that keeps coming all the time, how do you stay focused that, okay, these are my goals, this is my goal? Because, if somebody watching, they want to do it, but doing something for a longer period of time and investing that much, energy and time and effort into it can only happen once you are focused and everything. So talk to me about that. How do you manage that?
I'm always curious about the newer treatments. I read magazines. I attend international conferences. Recently, I attended a conference in Bangkok.
Nice.
And I came to know about many treatments that is not happening in India. So I just took that and I've started doing that in my
Share a
clinic.
few examples.
So, for example, I got a Miami peel, which is a D10 peel for removing your tanning and everything, which no one does, because that is something that when you travel, when you're exposed, you come to know about it. Secondly, we have a pink glow treatment currently. So we have launched that recently, and that is all about hydration again, that inner glow that we need along with the lasers. So that's a pink glow again. I also, attend the national organizations of Dermat and everything. So I keep myself very updated. I try to learn continuously, and I am surrounded by people who motivate and inspire me all the time. So
Yeah. And being a mom of one, it can be a little challenging task. But yeah, do you have any tips for our young mothers who struggle with how to balance the two?
the only, what do you say?
The tip
Being
or
a
the
mother, you just have to be calm. Yeah, and that's the only.
I think being the person, I think you have to be calm.
Yeah.
But I get your point. Yeah,
because
it's a good.
see, it's very challenging to work as a mother because I'm always running between my daughter and my clinic. So yeah, that's a mother task. Yeah.
Yeah. But I feel like it's a very good quality that you mentioned, calm.
Calm,
We don't
yeah,
hear that
yeah.
often, but calmness is important.
Yeah.
So now we'll move to a little more fun segment, which is
Okay.
called Curious Quick 5.
Okay.
So we'll ask you 5 questions and you have to be quick with it.
Done.
So are you ready?
I'm ready for it.
Great. What's the one thing that you're curious about lately? Apart from skincare, dermatology and everything.
Curious about Bollywood.
Okay.
Or just
Nice. Films.
and actings and everything.
Nice. Do you love acting?
I've never done acting.
You don't have inclination towards
No,
acting.
no,
You're just fascinated by actors and everything. Okay, good. What's the one person that you're curious about?
I'm curious about Narendra Modi because I'm not very much into politics, but yes, I would love to know him more, how he works and how he, manages the whole country.
Yeah, that's you giving some really lovely answers. I love that. Very unpredictable, unexpected. Love that. What's the one place you're curious to travel to?
Switzerland. I've already traveled once, but I would like to go there again and again. So, Switzerland, yeah.
Lovely. What's the one book or author you're curious about?
I love Ikigai because, as I said, since I became a mother, I am always looking for something which gives me more calm and more peace. So, yes, Ikigai.
Okay, nice. The Japanese philosophy of the manner.
Yeah.
Nice, nice, lovely. What's the one technology that you're curious about?
A fat reduction machine.
It was supposed to be outside skincare and
yeah.
dermatology, but okay.
Yeah.
Do you have anything else in mind?
About technology, I'm not a tech savvy
Okay,
person.
fine. Then I think the fat reduction. You're completely
fat
passionate about your work, so then we'll take that.
Yeah.
Great. So I think we've reached the end of our conversation with you. Do you have any last thoughts, anything that you want to share about how did you feel being here today?
Yeah, so I really had a great time speaking with you today, and I just want, I just want the listeners to take a message that if you're looking for a good skincare routine, start working on that today itself, because I'm sure good skin is good health, and your health reflects on your skin. So for good skin, just start working on your health. Thank you.
Lovely. That's amazing. We loved having you. Thank you so
Thank
much for
you.
taking the time and coming and, sharing your insights on the skincare and dermatology.
Right.
And thank you so much.
Thank you, Shruti.
Thank you.